Regarding prevention, I think many stakeholders, policymakers, healthcare professionals agree that this is very important and has a key role to play in protecting public health, also improving health system resilience. This being said, when you look at the investment made in prevention across Europe, this is really small, really minor. So we're talking about 0.5% of healthcare budget on average across Europe dedicated to prevention. So immunization is a fraction of this, and this is covering everything that is needed to be able to deliver the vaccines, promote information to the population, train healthcare professionals. So I think it's very important that we move from what we can do within allocated budgets to how can we think differently about the role of prevention in protecting our population across Europe. And when it comes to adult vaccination, I think it was very interesting what the Romanian State Secretary in the Ministry of Health was saying actually yesterday at a session looking into adult vaccination, is that there is this perception that vaccination is only for children. And so we also need to move to another way of looking at the role of vaccination throughout the lifespan of individuals. So vaccination is important throughout the life from infant until the elderly population. And when it comes to pneumococcal disease, we can see that there is a very big impact in terms of people being affected by the disease, the mortality rate still in Europe, but also the potential to actually preserve the health of the elderly population with pneumococcal vaccination. So this is really the way to go, and we need to work together to be able to achieve this vision. One way to do this, it's really to collect data and to discuss about the data that we see. What we know is that in Europe, there are many countries who don't have a vaccination registry, or when they have data collection, they are not actually using data to drive policy making. So I think the way forward is to make sure that we know what is the situation, how can we actually increase the coverage rate for routine vaccination, in particular in the adult population, where we know that it's very low, but also there are many gaps when you compare countries with countries in Europe, and then bring everyone together to look at what is the role of healthcare professionals, the role of public health authorities, the role that industry can play, but also patient organizations, civil society groups, to be able to increase the VCR, and also ensuring that the population is informed and trust actually vaccines and why vaccination matters. And this is, I think, a sustained effort that is needed. It's not a one-off kind of activity. And this is why it's so important that we have such discussions like in forum like the EHMA annual conference.